I can always.
Oh wait, okay.
Well, I can always splice the video if I need to. So are we both in the frame?
Mhm.
Can I say, hi Lindsay, how are you today?
Good, how are you?
Good. So we're going to learn about mobilizing the ankle joint today, specifically the talocrural joint. Okay, so what motions does the talocrural joint control?
Dorsiflexion and plantar flexion.
Right, okay. So I'm going to have you hop up on the table.
Okay.
Make sure we're in frame here. We are. So what bones make up the talocrural joint?
The tibia, the fibula, and the talus.
Perfect. So in order to mobilize that joint, if we are going to try to mobilize the talus from an anterior to a posterior direction, what motion would that help to improve?
Dorsiflexion.
Right. And then if we're mobilizing the talus from a posterior to an anterior direction, what motion would that help to improve?
Plantar flexion.
Perfect. So we are going to start with mobilizing the talus from an anterior to a posterior direction. In that position, I am going to help stabilize your tibia with this hand, and then I'm going to use the web space of this hand to come right over the talus. My body is going to stabilize the rest of your foot in slight plantar flexion to maybe a neutral position of the joint or a 0-degree position of the ankle joint. And then with a straight down direct force, I would apply that pressure to mobilize. Okay? So let's talk about the different ways that we can mobilize. If we are trying to target pain in this joint, we're using what grades of mobilization?
1 to 2.
1 to 2. So for a grade 1 to 2 mobilization, our pressure or our speed is slow, and we are not going into the end range of the joint's motion. So we're going to stay in that early joint motion for a 1 to 2 mobilization with a slow speed to try to help with pain. Okay? And then if we're trying to target stiffness of the joint, what grades of mobilization will we use?
3 to 4.
3 to 4. That, for grades 3 to 4, we're going to try to get into closer to end range. Okay, so more pressure, kind of feeling where you don't have any more room to go.
Mm-hmm.
And then your oscillation speed is going to be faster as you oscillate into that close to end range or end range of motion. Okay, so my body is directly over where I'm applying the force. I'm stabilizing the tibia with this hand, and then that web space is right over the talus. Okay, so grade 1 to 2, and then grade 3 to 4 right there. Okay, how comfortable does that feel?
Feels good.
Okay, all right. So again, that A to P pressure is going to help to improve if we're working into the grades 3 to 4. It's going to help to improve that dorsiflexion motion of the ankle. We can do a P to A mobilization in this same position. We can also do that on your stomach. So I'm going to show you both versions.
Okay.
So for a P to A mobilization in this position, I'm going to change my position here for the camera. We're going to help to stabilize the tibia here, and then we're going to cup where the talus and calcaneus are, right on the heel of the foot, and then stabilizing pressure here, mobilizing in that P to A motion along the calcaneus and the talus. Okay? Okay, and same thing, grade 1 to 2, slower speed, not going into end range of motion. Grade 3 to 4, more faster speed, working into end range. Okay? All right, why don't you practice both of those?
Stabilizing your tibia.
Okay, good. And then before you mobilize, what else could you do to give more stability to what you're doing?
Oh.
Yep, stabilize
Mhm.
the foot, good. Okay, good. So you've got great body mechanics, your pressure is going straight down over the talus. And what grade of mobilization are you doing right now?
I'm doing a 1 to 2.
Good.
I'm gonna go more into your end range now.
Yeah, there you go. Good. And your speed could be a little bit faster there. That's good.
Is that better?
Yeah. And what grade of mobilization would we classify that as?
This is a 3 to 4.
Good.
Does that feel okay?
Yeah.
Okay.
Yep. And again, when you're going A to P, what motion does that help to improve?
Dorsiflexion.
Good. Good. Yep, that felt very comfortable, and your body mechanics were great in trying to make sure that the force was going straight through the joint.
Okay.
Okay?
Okay.
Okay, good.
So I'm cupping like this?
Yes,
Okay.
we're cupping right under the heel. You're stabilizing the distal part of the tibia. That's it.
Okay.
Okay, and so a P to A mobilization, posterior to anterior, is going to help to improve
Plantar flexion.
plantar flexion. And what grade of mobilization are you doing right now?
The 1 to 2.
Okay, good.
I'm doing a 3 to 4 right now.
Good.
How does that feel?
It feels good. How does it feel to you? How do the body mechanics feel to you? Do you feel like you're having to use all arm, or do you feel like you can use
I think
your body?
I can use my body a little
Okay.
better.
Good. Does that feel better now? Like kind of twisting your trunk a little bit?
Yeah.
Yeah. That'll make sure that you don't fatigue as easily with it.
Got it. How does this feel?
Feels good.
Okay.
Okay, great. So let me show you the other way that you can do the P to A mobilization. You're gonna go on your stomach. So in this position, I'm gonna have you scoot forward just a little bit more. That's good. We're still stabilizing the tibia,
Mhm.
okay? We're still using the web space of this hand. We're gonna come right along the same area of the talus and the calcaneus. And then with that direct force down, you can stabilize the foot with your thigh if you need to. And then that's a grade 1 to 2. Slower motion, not going into end range. And then going into end range for 3 to 4 with a faster oscillation.
Got it.
Okay? Okay, give that a shot. Let me take this sheet. Okay.
Okay, can you scooch up a little
Yeah.
more? Thank you. Okay. There we go.
There you go. Good. Do you feel like you have control there?
Yep.
Good.
Doing a 1 to 2.
Good. And you're using your body to lean into that position.
Mm-hmm.
Good. That's excellent. Yep.
Okay.
You've got great control there. Do you feel
Yes, I do.
good? Okay.
How does it feel?
Feels great.
Okay.
Yep.
Okay.
Good. So let's talk about what are some reasons why, or what are some populations that we would end up using these modes for?
You could do it for patients that have hypomobility in their ankle, arthritis, and also if they had an ankle sprain
Mm-hmm.
and are lacking
Yep.
some motion.
Those are probably the most common reasons that we are using that in the clinic. What are some populations or reasons why we would not do these types of mobilizations.
Just if a patient has like a hypermobile ankle.
Yep. We could also be very cautious, contraindicated to use these types of mobilizations if the patient has a healing fracture in their foot or their ankle that has not been externally fixated. If they have any kind of active infection in that area, we would also want to stay away from mobilizing the joint.
Okay.
Okay? Great.
Thank you.